This is a nice report that actually is focused on the UK and their health data, but all the points they make about how to deal with air pollution to protect human health are very general and applicable to rest of the world as well. So I'll take some main points from this report. It's relatively long, even though I'm being brief. It probably will take me two podcasts, but let's see anyways. It's called A Breath of Fresh Air: Responding to the Health Challenges of Modern Air Pollution from RCP, Royal College of Physicians. According to PubMed, so I'm jumping ahead, there are over 60,000 scientific studies that link air pollution to health outcomes involving multiple diseases and across a lifetime, with more than half of them published in the last decade. So this paper is just from this year, 2025. Epidemiological and mechanistic studies have provided overwhelming evidence for the pervasive effects of pollution on almost all organs of the body. For combined outdoor and indoor pollution, this amounts to 8.1 million preventable deaths in 2021 worldwide, with 90% of them being attributable to non-communicable diseases, or NCDs. So if you just think about overall mortality from natural hazards, it's only about 1% of the total deaths compared to, let's say, cardiovascular diseases, which is about over 30% of the total deaths. And air pollution obviously kills a lot of people in terms of, you can call them preventable deaths or premature deaths and so on. So air pollution is one of the big outcomes of human activities, even though our focus tends to be on greenhouse gases and global warming. So somewhere along the way we have maybe reduced the focus on air pollution a little bit. At an individual level, exposure to air pollution shortens the average person's lifespan by 1.8 years, an impact that ranks just behind some of the leading causes of death and disease worldwide. Cancer has 2.5-year reduction, tobacco smoking 2.1 years, malaria 0.3 years, and inadequate water sanitation hygiene at 0.6 years. So 1.8 years compared to smoking at 2.1 years. It tells you that with smoking, often it's secondhand smoke, and person who is smoking, air pollution, you are exposing pretty much everybody. So if you live in a very polluted region, city, whatever, then obviously you might, it could be as bad as smoking itself, right? While low and middle income countries experience the greatest health burden of polluted air, the adverse health effects in countries with stronger economies such as the UK remain unacceptably high, with between 29,000 and 43,000 early deaths attributable to outdoor particulate and NO2 pollution in 2019. More than 1 in 19 deaths in the UK cities and large towns are related to long-term exposure to air pollution. Okay, so even though it's a UK number, as I said, this is pretty much applicable to the rest of the world as well. In addition to these long-term adverse health effects, jumping ahead, of air pollution, acute short-term exposures also trigger disease expression or exacerbation in those with established diseases. So pre-existing conditions are going to be exacerbated. This is most well documented in lung diseases such as asthma, as they say in the US, chronic obstructive pulmonary disease, or COPD for short, and lung infections. But air pollution episodes also precipitate acute cardiovascular events such as cardiac arrhythmias, myocardial infarction, and stroke, with increased hospital admissions and use of emergency services. Short-term exposures almost all sorry Short-term exposures also impact on seemingly healthy individuals, reducing both mental and physical performance. So well-being is seriously affected as well. Something like asthma is estimated to cost the US I think somewhere around $30 billion per year in terms of healthcare. And pollution, it's not just pollution but climate change related allergens, or pollen, etc., are also increasing, and often they are carrying pollution on them as well. So to look at some graphics, health effects of air pollution throughout life. So that's from some source. This is applicable to all: pregnancy, low birth weight children, asthma, slower development of lung function, development problems, more wheezing and coughs, and start of atherosclerosis. You can look up what that means. Adults, again, asthma, coronary heart disease, stroke, lung cancer, chronic obstructive pulmonary disease or COPD, diabetes. I have reported this elsewhere in the podcast as well. Or for older people, asthma, accelerated decline in lung functions, lung cancer, diabetes, dementia, heart attack, heart failure, and stroke. So with the large increase in evidence linking air pollution to adverse health outcomes in 2022, the EU recognized the need for stricter thresholds for pollution, more closely aligned with the new limits set by the WHO, enhancing the right to clean air and improved access to justice, provisions for citizens to claim compensation for health damage due to air pollution, strengthened rules for air quality monitoring to support preventive action and targeted measures, requirements to improve air quality modeling, especially if and where air quality is poor, so you can have early warnings which can really save lives, better public information overall. So let's jump ahead to look at recommendations from the report, RCP, Royal Committee of whatever it was. What was it? Royal College of Physicians, sorry. Air quality as a public health issue. Obviously, it's a public health issue. It's focused on UK, but it applies to everybody. There's no country now which doesn't have air quality issues. Even the US, which has exported most of its air pollution because it manufactures things outside, but still because of vehicular smokes and other sources, the air pollution is quite bad, especially in some places like New York City and LA and so on. Limit values. So governments across UK, but any government should work with stakeholders and citizens, including marginalized and vulnerable groups, children and young people, older people, minoritized ethnic groups and disabled people, to identify robust pathways toward the delivery of World Health Organization's 2021 global air quality guideline levels. Those are important because it may say PM 2.5 should be below something like 12 micrograms per meter cube in concentration, but some countries don't care even if it's well above that, sometimes 4 times above that. There are also air quality indicators which should be well below 100, but routinely many cities have more than 100 or even sometimes several hundred in terms of AQI. Governments must take increasingly ambitious action on air pollution as our knowledge about its role in causing and accelerating disease and impairing fetal and child developmental processes continue to develop. Governments must regularly review the effectiveness of the air quality limit values and population exposure reduction targets as public health measures, including assessing whether more stringent limit values, legally binding interim targets, or other tools and approaches would be more effective at continuously driving down air pollution and yielding the best possible public health outcomes, including a dedicated focus on populations with high levels of pollution and vulnerability to health outcomes. Especially children and elderly people deserve a lot of attention in this matter. If children can't play outside without having increased chances of asthma or other lung function development issues, then we have created a real mess, right? Action on air pollution at source. National and local governments must take greater action to tackle all sources of air pollution, increasing action where progress is already being made, and tackling areas that have been overlooked or lightly regulated, such as agriculture, indoor and domestic emissions. Countries which still burn biomass for cooking and warm eating, indoor pollution is significantly high and has serious implications for health of women, especially pregnant women and also children, infants, right? Public health campaign actions. Government should fund and deliver coordinated public health clean air campaign to provide accurate and trusted information about the health impacts of short and long-term air exposures, the sources of indoor and outdoor air pollution, and practical advice to reduce personal exposure. So, monitoring and reporting pollution levels, you have a few air quality indicator boards here and there, even in places like Mumbai, but obviously this is not enough because there are hardly one or two in the city, but you know that it's a very non-homogeneous issue, so air quality can be very different in even neighborhood levels, so we need to monitor much more closely. That will also help develop early warning systems better using AI and so on. National and local governments should ensure that public are fully engaged in the development of air quality policies and planning and built environment. National and local governments must take a health in all policy HIAP approach to the built environment and delivery of local services in urban and rural areas, including evidence-based policies covering transport, planning and development, active travel, and the provision of green and blue spaces and so on. And there are ideas to maximize health gain. So government can introduce statutory duty to increase integration of health in all environment and planning policies. National and local governments need to deliver improvements in the provision of public transport to reduce emissions. So obviously we are talking about climate mitigation and EVs, but public transportation is going to be a big part of reducing the number of vehicles overall, whether it's EVs or not, because even EVs will require energy. Even if energy becomes fully clear, you still have particulate matter being produced by wearing tires out, etc. And some of the EVs, in fact, have much faster degradation of tires because of the heavy battery weight and so on. Indoor air quality. National governments across the world should work with the research community, industry, third sector, and regulators to develop a cross-departmental indoor air quality strategy. It needs to address the health. This needs to address the health harms from exposure to air pollution, such as from wood-burning stoves or other damp and mold, or from damp and mold in homes, workplaces, transport and healthcare settings, and indoor public and retail spaces. So there are other details as well to make it location specific and food for purpose, revised product and building regulations, etc. Right? Inequalities and inequities have to be addressed. All air quality policy developed by national and local governments must consider the disproportionate impact of air pollution on certain groups. So obviously, this is an issue in terms of religion, ethnicities, informal dwellings versus industrial places and so on. A whole system approach is needed to join up public sector bodies and agencies with responsibilities for air quality, public health, education, social care and healthcare services to pool resources and deliver coordinated action. So again, that needs to monitor and evaluate and report and be evidence-based and tackle air pollution as a wider determinant of health and contributor to inequalities, because not everybody is exposed to pollution to the same level based on housing, travel mode, working outside, poverty, gender, etc., age groups, right? Net zero, then the Department of Energy Security and Net Zero, that's in the UK, but everybody has a Department of Energy anyways, has to ensure that air quality co-benefits are maximized and integrated into mitigation and adaptation actions for climate change and net zero. So the tunnel vision on mitigation, EVs, renewables, whatever else efficiencies, may not necessarily track air pollution impacts along the way or health impacts, so that has to be maintained as well. So fuel poverty, social housing, private rented sector, and those living in areas with greatest deprivation obviously need a lot of attention. Air quality needs to be included in organizations' corporate social responsibility or CSR initiatives as part of their green and sustainable action plans. CSR is big and companies often do good jobs, but are they paying attention to pollution or only focused on certain other issues? Health professions, the healthcare system in England but elsewhere also need to reduce air pollution from all sources, and they need to share data and support actions to improve air quality, integrate and analyze both central and local data sources to enable tracking of progress towards measurable air quality targets. Medical Royal Colleges, faculties and professional and membership bodies need to incorporate education on air quality into undergraduate and postgraduate training program, because many of the kids and elderly people are happily hanging around or playing outside without knowing what they are breathing, and it can be very relative. For example, in India, Delhi is a poster child or a showpiece for air pollution, especially in the fall winter seasons. So people in Mumbai may think we are not as bad as Delhi, but actually Mumbai air can be very poor as well, right? So health professionals and practitioners have a responsibility to speak to and educate the patients about health effects of air pollution and to advocate for cleaner air, so you can have bottom-up push for accomplishing air pollution reductions as well. In terms of research, air pollution researchers and policy makers should routinely make use of co-produced tools and methodologies from complexity science and participatory research to inform policy development. So everything is needed. I think this is the last one. Research and innovation and research councils and national institutes for health and so on should support studies, as well as charitable foundations should support studies on the effect of air pollution through the life course to address priority research questions and so on. So key areas for future research include identifying and understanding links between exposure and susceptibility throughout the life course, the lag periods between the exposure and short and long-term health impacts, etc., the negative impact of air pollution on mental and behavioral disorders, reduced cognition, impaired childhood learning, and dementia also mandates further research. And I worry specifically about the enormous number of street dogs in India which are exposed to pollution, and in Mexico City they found that the concentration of particulate matter in dogs of street, brains of street dogs are very high, and if that causes them to behave erratically in India, sometimes I think the largest number of deaths is from rabies, if I remember correctly, but nonetheless rabies deaths are fairly significant. So what's the relation between rabies and pollution, or susceptibility of dogs to rabies and pollution, or if dogs with rabies are more susceptible to attack people when they are also affected by pollution and so on. Okay, another infographic: the equivalent of around 30,000 deaths a year in the UK are estimated to be attributed to air pollution. We'll see a global number also soon, other than the 8.1 million preventable deaths we mentioned. Air pollution negatively impacts health at all stages of life, and early exposure can lead to ill health later in life as well. Impacts begin before conception and continue throughout pregnancy. Globally, around 2.7 million low birth weight babies and 5.8 million preterm babies each year are linked to PM 2.5 exposure. Air pollution overall affects almost every organ in the body, including the brain, lungs, heart, liver, and kidneys, and the diseases linked to them. So children are vulnerable, obviously, as they are just developing lungs and can have compromised immune systems if they are attacked by pollution, and brain development can be impacted negatively as well. Air pollution can cause or worsen health conditions in adults and is associated with cancers, as air pollutants can damage DNA. Exposure throughout life can substantially increase the risk of dementia. It's scary that we are breathing all this air, which pretty much has negative impact on everything. Summary of preconception and prenatal exposure to air pollution and various timings of their health effects. So here is a preconception air pollution attacking the child or the fetus, let's say. There can be transgenerational effects, so child health outcomes to adulthood. So obviously you are transferring from you to the next generation. So pregnancy, including adverse pregnancy outcomes, first month, so first trimester, second trimester, and third trimester to childbirth, and here postpartum as well, with maternal health outcomes to post menopause. So it's a lifelong impact based on when and for how long you are exposed. Summary of pathways from transmission of maternal air pollution exposures and responses during pregnancy and effects on placental, fetal, and child health. So child health outcomes, respiratory tract to circulation to placenta to fetus, and child health outcomes resulting from that. So you have impacts of respiratory tract, translocation of ultrafine particles, local response to air pollutants that is systematically propagated into mother's system, supports translocation of ultrafine particles to maternal issues and placenta, enables systemic propagation of signals from airways and other maternal tissues exposed and responding to air pollution, translocation of ultrafine particles to fetus, local response to ultrafine particles or systemically propagated maternal signals, propagation of maternal or placental derived signals onwards to fetal tissue, and then the child carries scars for a long time. Okay, so let me see if I'm maybe, since it'll take a little bit more time, it's already 22 minutes, so maybe I should stop here and read these more leisurely. Impacts of air pollution, let's see. Yeah, I don't want to squeeze all this into the same podcast because it'll be too much. So let's come back and continue with this topic in the next podcast. Okay, we have just a few more points to be made which deserve to be made without rushing them. Okay.